Our first stop in the healthcare and biotech sector is Artemis Hospital in Gurgaon. This state-of-the-art multi-specialty hospital was built in 2007 to fill the void in quality healthcare services and bring the latest and best technology in patient care to India.
Gurgaon was the Millennium City with really no structured healthcare happening in Gurgaon. And it was the concept of a promoter to start a state-of-the-art hospital in Gurgaon, which is patient-centric, and where the medical outcomes are given, but we also excel in our service outcomes.
Serving both Indian and international clientele, Artemis is a 300-bed hospital that boasts of world-class facilities and medical equipment. It's also in the process of acquiring the highest international accreditation in its field by next year.
Artemis was known to have pioneered into the field of infrastructure. We prided ourselves with the best infrastructure, all available under one roof.
I have spine disease. I went to so many hospitals, but no one can diagnose. Only Artemis can diagnose. Dr. Arun Saraha. In first sight he said this problem, he was so confident that I have full faith in him. For spine surgery, it's the best hospital.
With everyone from the guard to the reception staff trained in basic life-saving skills, Artemis Hospital's prime focus is prompt and comfortable recovery of patients. And the hospital lays special emphasis on hassle-free emergency services.
At an average, we get about 80 to 90 cases every day. On weekends, it is about 100 to 120 cases. And it's a mix of all sorts of cases, ranging from trauma to cardiac emergencies to poisonings. We also get a lot of gunshot and stab injuries. We have advanced life care ambulances with support, ventilatory support. It's just like a mobile ICU.
We are a 300-bedded facility, and the size actually is our advantage. We aren't too big, nor are we too small. So we are able to provide super specialty care, which is extremely personalized.
What are your expansion plans in the next few years?
Artemis, as we speak, is in the 5th year of operation, and we have seen a good amount of growth, great service quality, which people now know us for. We want to consolidate and build on it, move from 300 to 600 bedded capacity sooner than later. We have started another hospital in Dwarka, and our vision is to look not only at Tier A but Tier B cities, where we can have anywhere between 90 to 110 bedded hospitals and provide quality care.
What's the kind of government support that SMEs like you require in the healthcare sector?
The time has come for a lot of public-private partnership. Our endeavor is to give healthcare at an economical price. But unless the power conditions are bettered, the infrastructure is bettered, we have some subsidy from the government in the essentials which go to making or running of a hospital, it won't be possible. So one really has to look closely, and the options are very many. Absolutely. Where the government and private can engage together to bring the entire cost of healthcare down and provide healthcare to larger masses.
Personally, what would you say is the most satisfying part of your job?
Personally, when you see a patient who was on a ventilator and coming out of it and going back home on walking or on a wheelchair, you feel at the end of the day your day is made, because every life saved is a huge, huge satisfaction, no matter how many years of healthcare you have practiced.
With specialized patient care and world-class technology to back it up, Artemis is on its way to achieving new milestones in the medical sector, capturing a greater international market share and extending its reach to more and more Indian cities in the near future. So that was Artemis Hospital from Gurgaon, planning to go in for an all-India expansion now. Let's find out what Artemis can do to improve its business and growth from our SME doctor. Amit Chandar, partner at BPEP India, will be mentoring all the companies that we are featuring on the show today.
Artemis Hospital, as you expand from single location to operations across multiple locations, I would like to suggest two areas of focus. first, strengthen your systems and processes so that quality of service to patients is similar across all locations. And secondly, do careful site selection so that real estate costs do not eat into the economics of the new locations.